Hello, how are you?
Oh, I'm fine.
My name is Colette Moore. I am a student nurse practitioner, and I will be performing a cardiovascular peripheral vascular examination today. Um, can I have your name?
Imai Watson,
And can I have your date of birth?
August 19th, 2002.
Okay, and you're 18.
Yes.
Okay, so I have a couple of questions for you. Do you give me consent to do this cardiovascular peripheral vascular examination on you today?
Yes.
And do you also give me consent to record it, upload it to YouTube for my instructor to view?
Yes.
Okay, good. Before we get started then, I'm going to wash my hands. The first thing that I'm going to do is I'm going to perform blood pressures on my patient. I will perform the blood pressure where she's sitting upright on her left and right arm, and while she's laying down supine on her left and right arm. So for the purpose of the video, I will verbalize I am taking her blood pressures and I will give you the measurements. So I will start off on her right arm. Okay, I have 120/70. Then I will start off on her left arm. Okay, 120/76. Very good. I would have her lay down. Okay, while I have her laying down, I'm going to perform it on her left arm. I'm getting 118/70. And again on her right arm, I'm giving 118/76. There was not a significant drop in her systolic or her diastolic pressure when I took them. Both arms seemed to be very even, which was a normal finding. So moving on, I will now move on to her neck veins. I am going to be checking her JVP, which is her jugular venous pressure. And to do that, I'm going to have her turn her neck over to the right. I'm going to have her at a 30 to 45 degree angle. So that way I will be able to see her jugular vein. Again, having her turn her neck to her left. Sorry. So I am looking for JVP and I don't see it visibly. So I will be using some tangible lighting. With the tangible lighting, I am going to look over and I see it at her substernal notch, substernal notch. And now that I have located it, I am going to be using a straight edge. In this case, I'm going to be using a tongue depressor. So with the tongue depressor, I'm going to put it where I found the JVP at the suprastoner notch. I'm going to put it straight and I'm going to hold it horizontally. Then I'm going to take my measuring tape so I can measure. Going to measure going upright. Very good. And I have about a 1.5 centimeter at her JVP, which is a normal finding. If it was 3 centimeters, then I would have some concerns. So moving on, I am going to palpate and I am going to auscultate her carotid arteries. So in order to do that, I'll be using my stethoscope. First, taking the palm of my hands, I am going to have her turn her head straight again. And I'm going to be using my hands and I am going to palpate her carotid arteries. I'm going to start off at the one on the left. In the mid-neck line, I am checking for any thrills. Thrill would be like a cat-like purring. Okay. I don't feel any thrills, so I'm going to move over to the one on the right. Mid neckline, pressing into her carotid arteries. I am not going to palpate them simultaneously because that can cut off the blood supply to the brain. Okay, good. I don't feel any thrills. Now I'm going to use my stethoscope and I am going to auscultate her carotid arteries. I am going to use a diaphragm. The diaphragm would help me with high-pitched sounds. Then I will use the bell, which will help me with low-pitched sounds. Okay. I am going to take the diaphragm and I'm going to place it to the one on the left. And I am checking for any bruits or any murmurs. Okay, good. No bruits, no murmur on the left. Now I'm going to listen to the one on the right. No bruits, no murmurs. Good. Now I'm going to use the bell of my stethoscope, which is a small angle, and I'm going to listen to the one on the left. Then again to the one on the right. Good. Again, no murmurs and no bruits noted, which is a normal findings. So now that I have palpated and auscultated the carotid arteries, I'm going to move over to her chest and her trunk area. The first thing I'm going to do is I'm going to do some visualizations, and I'm going to be looking in all of the auscultatable areas. So I am going to visualize. I don't see any scarring. I don't see any pacemakers. I don't see any chest wall deformities. I don't see any abnormalities. And I see that her sternum is midline. So that's good. So now that I have visualized, I am also going to visualize for any apical pulsations or any precordial pulsations. So I am going to be looking down and I'm looking to make sure the apical pulsations are not visible, which would have been around the apex area. You will see the little veins rising up and down. So with the precordia, that will be the vessels on the arterial walls. I am visualizing. I don't see any apical impulse pulsations and I don't see any precordial pulsations. So I am now going to palpate these areas. So I am going to use the palm of my hands and the pads of my fingers. Again, palpating all auscultatable areas. So I'm going to take my hand above the substernal border at the second intercostal space, which is the aortic space, and I am palpating. Move on over to the left intercostal space at the sternal border. I am palpating the pulmonic. I am moving down, walking my fingers down to the second and the third Erb's point. I don't feel any thrills. I don't feel any lifts. I don't feel any leaves. I don't feel any abnormality. No murmurs. So I'm going to move over to the fourth, which is my tricuspid space. I'm palpating. Again, I don't feel any thrills. Then I am going to take my fifth intercostal space, which is the mitral, the mid-clavicular region, which is the apex of the heart. And I don't feel any thrills. Okay, good. Now that I have palpated those areas, the aortic, the pulmonic, the tricuspid, and the mitral area, I am now going to palpate the abdominal aortic area. So I'm going to get the palms of my hands. I'm going to go about an inch above the umbilicus, and I am going to go 2 inches from the left and about 2 inches from the right. And I am at the renal artery area, it feels like. And I am going to press down into her abdominal region, feeling for the aortic abdominal pulsations, and I'm about 2 altitude down, which is a normal finding. Anything above a 3 or 4 would have some concerns. So again, palpating, I'm going to go down to the 5th intercostal space around the midclavicular mitral apex area, and I'm going to have my patient turn over to the left, feeling for any pulsations. If there were pulsations, you'll feel it better if the patient is lying over to the left. All right, no thrills, no visible pulsations. So now I am going to turn her back onto her back. And now I am going to auscultate. I am going to be using the diaphragm and the bell of my stethoscope. Again, auscultating in all auscultatable areas. I am going to be listening for bruits or murmurs. Okay. So I am going to take the diaphragm of my stethoscope and I'm going to go to the 2nd intercostal space, the aortic region. No murmurs, no bruit. Then I'm going to go over to the left at the sternal border, 2nd intercostal space at the pulmonic area. I don't hear any bruits and I don't hear any murmurs. Moving on down to the 2nd and the 3rd, the urge point. No bruits and no murmurs. Okay, moving down to the 4th and the tricuspid space. Oh, good. No bruits and no murmurs. Now I'm going to move down to the 5th intercostal space at the mitral. This is the midclavicular space. I'm at the apex, which is the apex of the heart. And I don't hear any murmurs or any bruits. Again, I didn't see any lifts. I didn't see any heaves. I didn't see any abnormality on the chest wall. So now I'm going to auscultate the abdominal aortic. I'm going to use the diaphragm of my stethoscope, and then I'm going to use the bell of my stethoscope. I'm going to start an inch above the umbilicus, over 2 centimeters on the left, and about 2 centimeters on the right. I'm going to center my diaphragm, press in, and I'm going to auscultate. And I am listening for any murmurs or any bruits. I don't hear any murmurs. I don't hear any bruits. Okay, good. Now that I have inspected, I have palpated, I have auscultated. I had all normal findings, so this concludes my cardiovascular part of the exam. I'm going to move into the peripheral vascular part of the exam. So I am going to be looking at all 4 extremities, the bilateral upper and the bilateral lower. And I am checking the color to make sure the tone is even. I am checking the, feeling the skin for the warmth. And the skin is warm here on the right. And I'm going to check for the color and the warmth on the left. I am feeling to make sure there is no edema, making sure there is no varicose veins present and no shunts present. There is none on the left, so I'm going to look again on the right. Feeling for warmth again. I don't have any edema. I don't have any varicose veins. And I don't have any shunts present. So I'm going to move down to the lower extremities. Again, looking at the lower extremities. I am looking at the color. I am checking for warmth. I don't see any visible varicose veins. I don't see any edema. And I don't see any abnormality or shunts present. Looking at the one on the left, I'm checking the color. It is even. I am checking to make sure there is no edema. I don't see any edema. I don't see any visible varicose veins, and I don't see any shunts present. So now I am going to check my pulses. So I will be checking the radio, the brachial, the femoral, the popliteal, dorsalis pedis, and my posterior tibial pulses. So starting at the radial, I'm going to take my fingers, I'm going to palpate in. I'm going to feel. It is present. I don't feel any thrills. I'm going to give it a grade 2 on the one on the right. I'm going to check the one on the left. And I am feeling it is present. I don't feel any thrills. I give it a grade 2. I am going to check her brachial one on the right, which is in between. I'm going to push in. I feel it. It is present. I don't feel any thrills. I'm going to give it a grade 2. So I'm going to move over to the one on the left. I'm going to feel. It is present. I don't feel any thrills. I'm going to give it a grade 2. Very good. Moving on down, I'm going to check her femoral pulses. Again, using the palm of my hands, I'm going to feel inside down to the femoral area. Right in by the groin. Okay, wow. Okay. It is present. It is strong. I don't feel any thrills. I'm going to give it a grade 2. I'm going to give it a grade 2 on the one on the right. Now I'm going to move over to the one on the left. Feeling, palpating. I feel it. It is present. I don't feel any thrills. I'm going to give it a grade 2. Very good. While I'm here at the femoral, I'm also going to auscultate at the femoral. So I'm going to use the diaphragm and the bell of my stethoscope, and I am checking for any bruits or any murmurs. So I'm going to use this diaphragm. I don't hear any bruits. No murmurs. That is the one on the right. Now we'll check the one on the left. It is present. I don't hear any bruits. I don't hear any murmurs. I don't hear any extra blood flow turbulence. So I'm going to turn it over to the bell. Press it down into the femoral on the left. Again, using the bell of my stethoscope, which is the low-pitched sounds, I don't hear any murmurs. I don't hear any bruits. There is no extra blood turbulence. So I am going to move over to my right. I'm going to press it down with the bell, low pitch sounds. I don't hear any bruits. I don't hear any murmurs. Again, while I have my stethoscope, again, I'm going to use my diaphragm and my bell, and I am going to be checking the auscultatory areas. Listening again. I'm going to use the diaphragm at the aortic, at the second intercostal space. Moving on to the left intercostal, second intercostal space at the pulmonic. Walking my stethoscope down to about the third at the urge point. I don't hear any bruits. I don't hear any murmurs. Moving it down at the tricuspid. I don't hear any murmurs. I don't hear any bruits. All normal S1, S2 sounds. No abnormal S3. S4, no murmurs. I am going to be checking for S2 splinting. The S2 splinting is more pronounced when the patient is taking a deep inhalation in. And what this is, you normally hear the aortic and the pulmonic valves closing at the same time together. But when there's S2 splinting, there's a slight difference, and then they close separately. This could be a normal or an abnormal finding. So I'm going to have her take a deep breath in Okay. All right, they're closing together. Mitral valves are closing together, so no S2 splinting. Very good. So now I am going to continue my examination. I am going to move on to the peripheral vascular part of my examination. Okay, so I am going to be checking all 4 of her extremities again. So I don't want to miss it. I am going to be checking the color to make sure that it is even tone. I am going to be checking to make sure there is no shunts, no visible veins, no varicose veins, and no edema. And I will be feeling for warming. It is nice and warm on the right side. Again, I'm going to be looking at the left arm. I am checking color. It is evenly distributed. I don't see any edema. I don't see any present varicose veins. I don't see any shunts present in here. So that's normal findings. So I will be looking at her right leg. I am looking at color, nice and even. I am feeling for warmth, nice and warm. I don't see any edema. I don't see any varicose veins. I don't see any shunts present. Again, I am going to be looking at her left leg. So I don't see any edema. I don't see any varicose veins. I don't see any shunts present. The color is even, and I feel it is nice and warm. Very good. So I am going to be checking her fingers. What I'm looking at is a normal cap refill. So I'm going to press down. They're blanching. They are less than 3 seconds. I don't see any clubbing. I don't see any cyanosis. I don't see any hemorrhage splinting, and I don't see any tar staining. So looking at the one on her left, I am pressing down onto the finger beds. They are blanching. They are less than 3 seconds. I don't see any clubbing. I don't see any cyanosis. I don't see any hemorrhaging splitting, and I don't see any tar staining. So I am going to move down to her legs, her feet and toes. So if she has hair present, if there was no hair present, then I would have some concerns. I am looking at the toes. I am feeling they are blanching. They are less than 3 seconds. I don't see any clubbing. I don't see any cyanosis. I don't see any hemorrhaging splitting, and I don't see no tar staining. And I am looking at the one on the right. Now we'll look at the one on the left. I'm looking at the toes. I am feeling and pressing down. I am checking the capillary refill. They are less than 3 seconds. I don't see any clubbing. I don't see any cyanosis. I don't see any hemorrhaging splinting, and I don't see any tar staining. Very good. So now I will check my pulses. So I am going to start off at the radial pulse. I'm going to press into the radial area, and I'm pressing down. Good. It is present. It is strong. I don't feel any thrill. I give it a grade 2. This is the one on the right. So I'm going to check her radial pulse on the left. Pressing in. It is present. It is strong. Don't feel any thrill. I give it a 2+ grade. I'm going to check inside the brachial. Pressing in. I am feeling. I don't feel any thrill. It is present. I give it a 2+ grade. I am checking the brachial on the left. Pressing in. I don't feel any thrill. It is present. I give it a 2+ grade. Great. So moving down into her femoral. I am going to get a press down. It is present. It is strong. I give it a 2+ grade. Moving over to her left femoral. It is present. No thrill. I give it a 2+. Very good. I am going to move over into her popliteal. I'm going to have her bend. I'm going to put my hands underneath and I'm going to be feeling for a popliteal pulsation. I am on her right. It is present. I don't feel any thrill. And I give it a 2+ grade. I'm going to check the one on the left. I'm going to put my hands under. And I am going to feel for the popliteal. It is present. No thrills. I give it a 2+. Moving on to her dorsalis pedis on her right side. I am feeling the pulses. There is no thrill. It is present. I give it a 2+ grade. Now I'm going to move over to her left dorsalis pedis. Palpating. It is present. No thrill. I give it a 2+ grade. Moving over into her right posterior tibial. It is present. No thrill. I give it a 2+ grade. Now I'm going to move over into her left popliteal tibial. I am feeling it is present. No thrill. I give it a 2+ grade. Very good. Now I'm just going to have the patient sit up. And I'll be touching my stethoscope. I'll have her lean forward. And what I'm checking for is unusual murmurs. So I'm going to use the diaphragm on my stethoscope. And I'm going to press it in the second intercostal space at the pulmonum. Move over to the left intercostal space. Go back over to the right, sorry. I am in the aortic, second intercostal space. Moving over to the left pulmonic. Down to the third intercostal space at the urge points, paying special attention. Listening for that soft sound. No murmurs. Then I'm going to move down to the fourth of the tricuspid. No murmurs. And then I'm going to move into the mid-clavicular region of the mitral, which is the apex of the heart, PMI, point of maximum impulse. No murmurs, no bruit. Okay, I'm going to do the same thing with the bell. Second intercostal space. Aortic. Moving over to the left. Second intercostal space, pulmonic. Walking my fingers and stethoscope down to the third, fourth, and fifth urge point at the fourth tricuspid. Fifth into the mitral, which is at the mid-clavicular region. Okay, very good. I had no murmurs and no thrill. Seemed like you could hear better if the patient is leaning forward while you're auscultating. So this concludes my peripheral cardiovascular examination. Thank you so much for watching, and thank you so much, Amaya, for participating. Bye. Wave me, Maya. Say bye.